One of the many questions that I continually get is, are Medicare supplement plans worth it? And in this video, I'm going to show you that yes, they are worth it. And I'm going to explain to you the difference between Medicare supplement plans, Medicare Advantage plans, and what are the best plans for each of these. If you don't know who I am, my name is Brian Monahan. I've been working with people going on to Medicare and my clients that have been on Medicare for the past 15 years. And what I try to do in these videos is narrow everything down to the raw data so that you can understand what it is that you're looking at and what you might want to choose as far as your supplement plan goes. So let's dive into the video. The first thing that I always explain to people, and I'm going to go to this page on a book that I wrote. If you need this, it's free. It's in the description box below. It'll be in a link. But this page shows how simple it is when you first go on Medicare. The first thing that you're going to do is sign up for Medicare Part A and B. That you do through the Social Security office. The second thing that you're going to need to do is decide whether you want a Medicare Advantage plan and a Medicare Supplement plan. Now, the reason that you need to do this is because this will take away 50% of what you have to think about. If you go with a Medicare Advantage plan, your package is complete. You don't need to choose a drug plan. You don't need to choose vision, dental, and hearing because it's packaged all together with the Medicare Advantage plan. If you go the opposite route and choose a Medicare Supplement plan, as you see on the screen, you have to choose a Part D plan and a vision, dental, and hearing plan that is separate from your Medicare Supplement plan. So let's jump over to this screen that shows you the numbers. So if you see the Medicare A and B card on the screen, that is going to cost you $164.90 a month, and you will pay that to the federal government. So everybody has to pay that. There are some people that will pay a little bit more than that because this is an average. If you're a high income earner, you'll pay a little bit more. If you're a low income earner, you could pay less and possibly even zero. But for the average person, $164.90 is what they will pay to the government no matter what plan they choose, a supplement or an advantage plan. So let's take a look at the most popular Medicare supplement plans. Plan G is probably, it's documented that is the most popular and the most purchased Medicare supplement plan. This is because it's the most comprehensive plan, and I'll explain what you have to pay with it and so forth. But most people get on a Medicare Plan G in this year, 2023. Plan N is next, and then Plan High Deductible G. And I'm going to explain the differences between those three plans. So the first difference that you'll see is the premium. For Plan G, you're going to pay $140 per month on average for someone who's 65 years old. Now, I did an average throughout the entire country, so if you live in Manhattan, obviously it's going to be more expensive. If you live somewhere very rural, it's going to be less expensive. But an average is $140. Now, what do you get with this Plan G, and why is it so popular? Well, once you pay that $164.90 to the government, and then you purchase a Plan G, let's say you pay $140, you will pay nothing to go to the hospital or inpatient. So you can be in the hospital for as many days as you want, and up to a year, and you will pay zero for that premium. Now, the only thing that you will pay for medical-wise is $226 in a deductible for the entire year. So if you do the math, if you scroll to the maximum out-of-pocket over there where it says $1,906, that would be the maximum that you would spend for the year. And how I came to this conclusion was I took 140 times 12 months, and added that $226 deductible, and that's the only thing that you will pay. If you see on the screen, you won't pay for hospital. You will, after the 226, you will not pay for doctor, specialists, or anything like that. You won't pay for CAT scans, MRIs, PET scans, and you will have up to 100 days of skilled nursing at zero cost to you. Now, what does the Plan G, what doesn't it cover? There's a few things that it does not cover, and I'll scroll down here. The two major things are it does not cover a drug plan, but drug plans depend on the drugs that you take, the cost of them. Some drug plans are, I've even seen them as low as $1.55 or something a month. Most of them are between $5 and $15 a month if you're only taking a few generics. If you're taking some brand name drugs and they're expensive, I put in here $35. That's probably the most that you're going to pay unless you're on some extreme drugs. Now, you still have copays with these plans, but the cost of the actual plan will be somewhere in between $5 and $20, most likely. Next is dental, vision, and hearing. These plans the supplement plans do not cover dental, vision, and hearing, so that will be an additional cost. There are dental plans that are $8 a month. Some people don't want vision or they don't want hearing, they just want dental. Other people just need hearing. So there's different plans and different prices. You'll have to speak to a broker about that can give you some plans in your area because it does go by zip code. So let's scroll back down. So that was the Plan G. Now, Plan N and Plan High Deductible G. Let's go over Plan N. The premium is going to be about $35 cheaper each month. This plan is becoming more and more popular as time goes on, meaning these plans are from 2010. I'm pretty sure all three of these are from 2010 when they started. They could have started earlier than that. But since 2010, more and more people have gotten on the Plan N year after year than the year prior. The reason being for this is $35 cheaper a month. The hospital coverage is exactly the same. You will pay nothing when you go to the hospital. But the difference comes with the doctor's office and the emergency room, and I'll explain this. So for Plan N, if you see on the chart here, you're going to pay that $226 in a deductible for the year, just like you would with the Plan G. Now you're going to pay up to $20 on top of that each time you go to the doctor. This includes the specialists. So what I did was I put that you went to the doctor's office 10 times. So you see 226 plus 10. Now if you never go to the doctor, obviously you can, or you go once a year, you can just put add $20 to the maximum out of pocket, as you see over here. Now I put 10 times, so you're going to do $106 times 12 plus the 226, and then if you went to the doctor's 10 times and they charge you the full $20 each time, even though the average is $13, you're going to have to add that $200 also. And I came up with $1,698. So if you only go to the doctors or specialists 10 times, then Plan N is going to be cheaper for you to purchase. Now there's two other things that the Plan N has that Plan G does not have, or I should say that is a cost to you. Another thing is a $50 emergency room that's waived if you go and you're admitted into the hospital, but it will cost you $50 for the emergency room. And then the other thing is a 15% charge for, it's an excess charge that some doctors charge. It's less than 3% of the doctors in the country, but if they do not accept Medicare's payment, they can charge you 15% on top of what Medicare's payment allotment is. So, but I've been doing this, like I said, for 15 years. I've never had one of my clients call me and say, I got an excess charge for Plan N. A lot of doctors that don't accept payment will even waive this for a lot of people. And like I said, it's less than 3%. So Plan N is becoming very, very popular. As far as drug coverage and dental, vision, and hearing, it's the same as Plan G. You have to get a separate drug plan and a separate dental, vision, and hearing if you want it. And so that's how that works with all these plans. Then you have a high deductible G. And for this plan is becoming very, very popular because people want to save money on their premiums. The average throughout the country is $40 for someone who's 65. And what this is you pay 20% of all your costs up until $2,700. So if you go to the doctor and it's a $100 visit, you'll have to pay $20. If you go, each time you go, you'll pay that. Most people that I've seen don't come close to the 2,700. And as I say in most of my videos, there's one company that I have that if you get on a high deductible G, after 2 years, you can get on any other plan that they have, and they have a plan, regular plan G and a plan N. You can get on this without underwriting, no health questions, nothing, no matter what happens to you in those 2 years. And you'll get on whatever plan you want from this company, and you have 30 days to do that. So that's pretty cool. And a lot of people that are very healthy and do not want to spend money on premiums will go into that plan. Now, what's the difference between the Medicare Advantage and these three top Medicare supplement plans? Well, the main difference is the Advantage plans are zero premium for the most part. Those are PPO and HMO plans. But I constantly get calls. If you do not live in an urban area, you really should think about the Medicare supplement plan, because I get calls all the time from people that say, I called this broker. They told me to get on an Advantage plan. I can't go to certain doctors. I can't find a dentist that takes this plan. I can't find a hospital that I want to go to with a surgeon that I want to use. That happens all the time, especially if you don't live near a city. Sometimes it happens within the cities, and you really have to watch out, because Medicare Advantage plans sometimes argue with the payment that they give to the doctor. So this can be pretty brutal for some people. Now, the difference is they charge you zero up front, but a lot of times you have to pay $250 a day in the hospital, whereas the other plans, these other three plans that you see, the Medicare supplement plans, you might pay up front, but you pay nothing when you go to the hospital. And these plans are accepted anywhere that accepts Medicare. You don't have to look up networks or anything. For the Medicare Advantage plans, they'll charge probably zero for primary care, but they might charge $35 to go to your specialist. And then, of course, you have CAT scans and so forth. That might cost $200 or $300. And the skilled nursing, you only get 20 days as opposed to 100. So you get 80 days less at zero cost. Now, the maximum out of pocket for a lot of these plans could be, especially the PPO plans, $7,550. Now, you might be watching this video saying, well, my Medicare Advantage is only $1,900, and it comes with a drug plan and all these other things. That is possible. But the thing that I've seen is when you have a plan that's $1,900, number one, the maximum out of pocket, that's $1,900. Number one, a lot of doctors will not accept that plan. Number two, a lot of some of the things that you want to do, the plan will not pay for it. So that's another thing you have to watch out for. The thing that really entices a lot of people with these plans comes with a drug plan. A lot of them come with dental, vision, and hearing. They come with a flex card, which means you get to go to CVS or Walgreens or Walmart and spend $40 a quarter, sometimes $100 a quarter on stuff like toothpaste and over-the-counter items. Also, they come with gym memberships a lot of the times, and there's some other enticing things that people want to get on Advantage plans. If you were to ask me my opinion, I do have people that live in major cities, let's say, or the network is very strong for Medicare Advantage plan, their Medicare Advantage plan. So I do have clients on certain Medicare Advantage plans, but it has to be a specific situation. Most of my clients are on Medicare supplement plans. Most of them are on a G plan. Next up would be an N plan. And this year, I looked at my client list and it's about 50-50, people getting G or N. And of course, about 10% of my clients are on the high deductible G plan. But what I do is I try to find you the least expensive plan that you like. So some people like name brand companies like United Healthcare or Aetna. Some want a lower priced plan and they don't mind that they've never heard of the company name. So we kind of work together and try to get you the best plan. As far as my concern, I just want to get you on something that you're happy with so that you're a happy customer. It does not matter to me what company you go with or what plan you go with. I just give you the facts of each one of these, and then you make a decision on what you like, unless you completely need my input or opinion and so forth on what I think. So that's basically it for this video. If you have any questions, you can, number one, go to the links in the description box, click on them. One of them will go to my book, which I showed you here, and I'll scroll up to the top. Basically, you click on it, it goes to my website. You don't put any of your information in. You can read this for free. There I am in a picture. As you can see, I don't have hair on my face anymore. A lot of my older videos I did, and caught some heat from it. So shaved a little bit. We'll see if I bring back the beard. But this has chapters in it where you can click on the chapters and it will go right there. So it's right on the website. You can look at that. Thanks for watching the video, and I'll see you at the next one.